Hey, I'm Dr. Miguel Cruz with Cruz Life Center, and I want to talk to you today about degenerative joint disease. And a lot of people that I run into seem to think that once they've got degenerative joint disease, there's nothing they can do about it, and they're just gotta live with this pain and with this problem. And I can only tell you that that is so untrue. That's just been what they've been told by their doctors, because their doctors really don't have anything for them. They basically say, well, just put up with the pain till it's bad enough. When it gets bad enough, come on in and we'll do back surgery on you. And it does not have to happen that way. So we're going to talk a little bit about that. And I'm going to use some models to give you a better understanding here, and we'll get some close-ups here, and I'm also going to show you what this looks like on an x-ray. So here we see there's three phases of what we call subluxation degeneration. Subluxation being when the spine's out of alignment, which is what causes this whole problem. We'll talk about that here in just a minute. But here's normal. We see two bones, we see the disc, and here we see the nerve. And I want you to pay attention to the fact that the nerve here has got plenty of room right there. So here's what we call a phase one. This is would be probably a recent injury. The disc is swelling, putting pressure on that nerve right there. And that looks like it might be a painful situation, and it certainly can be. But what I want you to realize with this is because this nerve is actually a nerve root composed of thousands of individual nerve fibers, what's important to realize that only 10% of these nerve fibers carry pain signals. The other 90% are either going to your muscles or going to your organs, and they don't feel pain. So theoretically, you can have this problem going on for years with little to no pain until it just gets bad enough. So if this problem continues and it's uncorrected over many years, then the damage starts setting up. And what causes the damage, what we see an example of here of what we call the phase two, is the best example I can give you is consider the front end of your car being out of alignment. What's it do to your tires? It wears them out, doesn't it? It wears them out prematurely and unevenly. Well, degenerative joint disease in the spine and in most joints is uneven and premature wear going on there. And I'll show you some examples of that on an x-ray here in just a minute. But here you see actual bone spurs. You can see where that disc has gotten considerably smaller. And what's important here is what you see in this situation. The opening where the nerve comes out now has gotten proportionally much smaller. So there's less room for error now. Smaller amounts of inflammation will cause more potential for pain and other types of symptoms depending on where those nerves happen to be going. And then as the problem continues to get worse, you can see it just gets pretty nasty looking. My job as a doctor of chiropractic is to prevent this whole process from continuing on and getting worse. It is controllable. That's what's important to realize. It doesn't have to get worse. And we can actually get you feeling better by simply getting to the root cause of the problem and getting some of that inflammation under control, which is what's going to cause most of your pain. We can't necessarily reverse this whole process, but we can certainly control it. And that's what we concentrate on in our office. And we'll talk about the different things we do for that here in just a minute. Before we do so, I'm going to show you some x-rays. What we see here is an x-ray side view of the lower back of a 33-year-old. And what I want you to notice, here are your vertebrae. The darker space in between is where the disc sits. And I want you to notice that one looks good. This one looks pretty good. All these look pretty close to the same till we get to this lower one. It's a little harder to see because that disc has been deteriorated by at least 50% or more. And this person is only 33 years old. We can't blame old age on that particular problem. Now, if we go to this next x-ray, now here we see an x-ray, same thing, lower back, side view This person is significantly older, and their history was a long history of lower back problems. And this person was a farmer, and they were able to just take their pain medications and continue with their farming for years. And eventually it got to where the pain medication no longer helped this person. That's when they ended up in my office. And the interesting thing was, before he came to me, he went to see an orthopedic doctor who basically said to him, well, you know, you're old, you got arthritis, what do you expect at your age? That's normal. You just got to learn to live with it. And he said, basically, if it gets bad enough, come back and we'll do back surgery. Well, my answer to him was very simple. If you notice above here, you've got a pretty wide disc. It's actually a pretty good looking disc. This one here, you don't have to be an expert to see that that disc is almost gone. This bone, I've got these red lines here showing that that bone is slipped forward on the one below it. These lines should be in line like these are, and that one here is slipped forward. This disc here is also looks terrible. That thin black line is all that's left of that disc. And then down here below is another healthy disc. So my answer to this gentleman was, well, if we're just going to blame that on old age, it seems to me that this disc and that disc are just as old as those two. How come they don't have it? And the response I got from the gentleman was, well, I never thought about it that way. And it's the reality. What the difference is the longer you've had a problem, which he's had a problem for many years, the worse it gets. And by just taking pain medication does not fix anything. As a matter of fact, that particular strategy has caused the opioid epidemic that we have today, because of people just taking medications for their pain and not really doing anything else for it. So this person could have been fixed, and this problem could have been avoided had they seen me 30 years sooner. Now, I was still able to help this person. He was already in a phase 3 decay, which was pretty darn bad, and we got him with a better quality of life. He was able to get back to working again, but there's no way that he was going to get back to a normal, what he used to be able to do. It's just too far gone. But he was happy with the results that we were able to get for him. So if you were to come to me with degenerative joint disease, basically there's a threefold approach that we would take. First, we want to get the mechanics of your spine right. I like to take an x-ray and assess the alignment of the spine, particularly the area that's involved, and let's see if there's some corrections that can be made right there. And that's what chiropractic does. We use a very gentle technique using instruments that feels good, so we don't do any of the old, what I call the old-fashioned popping and cracking, to get the spines back into alignment. Another thing that we do that's very important, particularly when somebody's had a late stage degenerative process where they're into a phase 2 or a phase 3 of the degeneration, is we'll use what's called a low-level laser. The laser is clinically proven to help reduce inflammation, regenerate cartilage and bone tissue, and get some blood circulating into the area, and it literally heals tissue. It's probably one of the only, if not one of the only, therapies out there that we can legally make the claim that it is able to heal tissues. And then we also look at it from a nutritional aspect, particularly reducing your inflammation. Most people's pain is a result of inflammation. So if we can reduce the inflammation, we can get you at least feeling better, if nothing else. And there are a lot of natural nutritional compounds out there that will help reduce the inflammation without any dangerous side effects. So bottom line here is, if you've been told you've had degenerative joint disease and you're just learning to live with it, don't believe it. There's so much you can be doing to be proactive. You can keep the problem from getting worse, if nothing else, and you'll be surprised at how much relief you can get with the proper care. So once again, this is Miguel Cruz with Cruz Life Center. Thank you very much. God bless.